Public health expert Ebuta Agbo joins us from Abuja for more on this. Good evening and thank you for joining us.
Good evening.
Now, how do you perceive what could be going on in Kano State with strange deaths and mass burials?
Well, the events in Kano are very disturbing, no doubt. But for one to be able to say categorically, you would need to have tested all the dead bodies for coronavirus and have evidence to suggest that yes, indeed, it was as a result of coronavirus. However, in considering that we have a pandemic that is quickly evolving, one cannot argue with a lot of people who would claim that it's likely to be as a result of coronavirus. But it will be difficult to say it with all amount of certainty that it is due to coronavirus. So what the government can do going forward is to set up a procedure that allows testing of dead bodies in a situation like this, since the number of people who reportedly are dying during this period is on the rise. So it's difficult for government to clearly say that this is as a result of this, but of course it is the chances are significant.
Now, while it is crucial to testing the corpses, the Kano State government, as you heard in the earlier report, is already overwhelmed with the situation, hence the invitation of the Federal Ministry of Health. Can the state or even the federal government afford the cost of testing the corpses at this time?
Well, it will be difficult for me to categorically say that. But when you look at countries like Italy, Spain, that seem to have stronger economies than ours, and even the United States, despite their very big financial and economic war chest, are still grappling with that. So I think it's going to be a significant challenge to insist that all the corpses should be tested. What we should focus on is to institute some of those measures that will slow down the infection rate and increase government capacity to intervene. Apart from what we have been talking about, things like the social distancing, the hand washing, and of course, when on the 1st of April, we insisted that we should take serious measures to ensure that most Nigerians, if not all Nigerians who are at risk, are masked with homemade face masks that would reduce the risk of transmission from people who are infected and they are not aware, and therefore try and to a large extent cut down case fatality and case infection rates.
Public Affairs Analyst Mr. Ebuta, I wish we could continue with the conversation, but we thank you all the same for talking to us.